very warm to this webinar on basics of geriatric care. I am Kirti Alani, consultant at CHIP Foundation and the moderator of today's session. It's my pleasure to guide you through this meaningful discussion organized by CHIP Foundation in collaboration with Eco India. To begin, we will have a welcome address where I'll brief the set of context to today's theme and importance of today's discussion. This will be followed by brief introduction to CHIP Foundation and its initiatives by Professor Dr. Ravi Malhotra, founder of CHIP Foundation, whose vision has shaped our efforts in preventive and community health. With this background, I would like to introduce Sir, the founder of CHIP Foundation. It is only his vision that has guided us in successfully initiating this webinar. Dr. Ravi Malhotra is currently serving as visiting professor of Public Health Society at Hull York Medical School, UK. He is also extraordinary professor at Pan-African Cancer Research Institute, University of Pretoria, South Africa, and director of Indian Cancer Genomic Atlas, India. He previously served as director of ICMR and ICPR, Noida, and WHO FCTC Global Knowledge Hub for Smokeless Tobacco Hub, and NTT Labs as well. So I welcome you, sir.
Thank you, Kirti. It's a pleasure to be here. At the outset, let me welcome all of you to this particular webinar on a relatively neglected subject. So before I talk about the theme of the meeting today, I would just like to briefly introduce our foundation, which is CHIP stands for the Center for Health Innovation and Policy. We are a not-for-profit organization based in Noida, registered with the government. We focus on the intersection of science, technology, and public health. And our mission is to strengthen India's healthcare system by identifying systematic challenges and developing innovative and hopefully sustainable solutions. And what we hope to do is promote evidence-based practices in healthcare, advocate for effective data-driven policy from the policymakers, and also help researchers in shaping the best public health system and best care possible. We also build professional capacity and spread awareness like we are trying to do in this particular session. And we develop and deliver high impact training and awareness programs emphasizing preventive care, because I feel that is, again, are very, very complicated as far as India is concerned. We do not really do a lot of stuff in prevention, and geriatric, of course, is a very important aspect in this area. I'm sure many of you are familiar and are aware that India's elderly population is rapidly increasing, and at the present moment it exceeds 120 million. The group is expected to constitute roughly 12% of the total population by this year. In addition, aging is related to an increased prevalence of chronic disease, whether it is heart disease, bone disease, or lung disease. So it is a problem as far as increased prevalence of these disorders. They also have a greater economic dependence and face unique mental challenges. So what is required is a growing need of specialized, hopefully compassionate care models which are geared specifically towards older adults, rather than one size fits all. As far as the data and demand indicators are concerned, the health trend shows that there's a growing incidence of non-communicable diseases and age-related conditions like cancer, bone diseases, heart disease, diabetes, and dementia in this particular group. There is a systematic gap and a rising demand for care, which is unmet with a limited trained workforce, insufficient infrastructure for geriatric health. Most people do not even know, and unfortunately, most medical schools and universities in the country do not have any specialized department or faculty who are trained in geriatric health. So there is an urgent need for targeted geriatric training and widespread public awareness. As Kirti mentioned, it's time that we start looking at how we can care for ones who looked after us when we were young. So this webinar, what are the expected outcomes and benefits? For participants, we are hoping that they will gain practical insights into a comprehensive geriatric assessment, disease prevention strategy for the elderly, and principles of promoting healthy aging. As far as the primary goal is concerned, we would like to build awareness and capacity among these various caregivers, healthcare professionals, and community stakeholders. And the ultimate aim is to guide attendees for better management of the elderly health, improving the quality of life for India's aging population. We have a panel of experts from various universities, from various hospitals, and medical schools who will be sharing their knowledge with us, and I look forward to a very interactive session where we can discuss practical problems that are faced by the ones who are caring for the elderly, and also what are the practical ways of implementing better care going forward. So I wish you all the very best, and I hope that all the attendees become experts in this area, either by their passion or by their profession, and they carry on the torch in helping people who really need this help. Thank you so much.
Thank you, sir. Thanks a lot for your vision and guidance, as always. Now, carry forward to our session. I request Pratibha to play a video. This video will help all of us to connect with the webinar objectives. Let's see and come back with our perceptions. Thank you.
And Kirti, you would also like to emphasize this is courtesy HelpAge India, which is an organization which works with the elderly, and we are
Yes.
very thankful to have their help.
Ji, sir.
Can you help with the voice, please?
पिंकी
Just a minute, sir. Let me see.
पिंकी
जी पापा।
मम्मी को दे दो।
समोसे?
एक मिनट ये दादी के लिए।
मेरी दवाई लाए?
हाँ।
कोई पिंकी क्या है? दवाई।
पिंकी, जा पापा से पूछ क्या वो कितना लेंगे।
पापा आपको दो दूं?
नहीं एक ही देना, और जरा चाय का भी देखना।
हाँ हाँ मम्मा बना रही है।
ये नथुराम का है क्या?
हाँ दादी, नथुराम के।
ये लीजिए एप्पल।
पता नहीं अब कैसे बनते होंगे।
वैसे ही बनते हैं माँ, जैसे पहले बनते थे।
पहले तो यूं बड़े बड़े बनते थे, असली घी में बनते थे, उसमें बादाम डाली हुई रहती थी। पता नहीं अब कैसे बनते होंगे। पिंकी
जी
एक टुकड़ा देना मुझे, थोड़ा चख लूं।
कुछ नहीं मिलेगा आपको।
एक टुकड़े में क्या हो जाएगा?
क्या हो जाएगा? क्या मतलब क्या हो जाएगा? उल्टा सुल्टा खाते रहती हो, तबीयत खराब करते रहती हो। हमें और कोई काम नहीं है? कभी चिक्की छुपा के खाती हो तो कभी भुजिया। चाहे लूज मोशन की नदियां बहती रहें।
100 बार सुना चुका है।
अब बच्ची हो, कुछ समझ नहीं पाती हो।
तू अकेला ही समझदार है, मुझे कुछ आता ही नाही, जैसे यही अकेला समझदार आहे. कुठे जायचं, काय करायचं काही कळत नाही. एकटा जीव म्हणतात सदाशिव, काय करायचं. जायला पण कुठे जागा नाही. ही मुलं सगळे मागे लागतात, हे नको खाऊ ते नको खाऊ. कुठे जायचं, कुठे उभं राहायचं, कुठे राहायचं.
Courtesy to Helpage India for this video. Let us always remember that caring for the elderly is not just about meeting their physical needs. It's all about to understand about their emotions and giving them respect, love, and patience as well. So moving ahead with our session, now I request Dr. Thushti Bhardwaj for the opening remarks, and she will share her insights on strengthening geriatrics awareness and capacity building. Dr. Thushti Bhardwaj is a professor in the Department of Social Work at Dr. Bhim Rao Ambedkar College, University of Delhi, and visiting senior lecturer at Cicely Saunders Institute, King's College, London. With nearly 2 decades of teaching and research experience, she specialized in palliative care, cancer care, and gerontology. She has authored several national and international publications and developed a validated tool for assessing caregiver burden in cancer care. Over to you, Dr. Thushti ma'am.
Thank you so much, Kirti, and many congratulations to CHIP Foundation for this initiative of educating our young generation about elderly care. I would like to make 2 important points here, which our young generations take lessons from. Number 1, that why are we today talking about elderly care? It is actually, which is something was in our culture once upon a time. Today, we can say that either due to globalization or other forces which are operating around us, we are going away from our culture. When I say culture, which means the joint family system was once upon a time a norm, wherein one or other family member used to take care of the other family members, be it children of the same ages or maybe elderly. And that was never a question few decades ago. But as we are moving to the modernized world, as we are claiming ourselves that we are approaching to the mark of a developed country, but unfortunately there are few parameters wherein we need to take a very conscious decision that are we really moving ahead if a part of our population is looking forward to us for care needs and their care needs are still unmet. And this population is elderly population, because the young generations, they are moving ahead with their dreams, with their goal, and the something which was there in culture, it is now diminishing. So we need to have a big question: does modernization or approach to modernity ask us to detach from our culture? The question should be no, it does not. A country's progress cannot be taken up if the country is devoid of its culture. So, whatever the Western world is doing, that might be a good eye opening that we learn from them, but we do not forget what we have in our own capacity. We must respect that. This is one which I want to say. And second point, I would like to mention that of course our demographic population is changing, and in couple of decades now, the population is also changing at the top of the pyramid, where elderly population is increasing. Reason being that there are certain positive development in terms of medical care facilities. So our populations are living longer, our longevity has increased. But on the same hand, the number of diseases to this population has also increased, which is a matter of concern. So as people are living, their healthy life expectancy at age 60 is going down, which means a number of disease are there which need to be taken care of in addition to a healthy human being. So a healthy human being cannot be detached from the body, which is now being overlapped by a number of diseases. So which means, so our aging populations will have a lot of burden of diseases which make them more vulnerable for care. So, and among this population, the female population is going to be high in number, because the death rate among male at after 60 is much higher than the female. So in India, our elderly population is going to be characterized by more female population. So that is how, and these are the female which have cared for us at once upon a time when each one of us were born and they have grown up. So that becomes our moral, social responsibility that we move towards to a healthy population, instead of being a population which is though living longer but living with a lot of diseases. So each one of us to care for ourselves now, and in addition to care for our elderly, so that we live more happily and we become a more developed country with our culture ahead. With these remarks, I would like to congratulate the organizers once again, and to the audience, to the participants, to take learning lessons from this webinar and take it further in their respective career, so that wherever they are working, they are putting those knowledge to their practice. Over to you, Kirti. Kirti, you are muted, dear.
Thanks a lot, ma'am. Thank you for your guidance on importance of elderly care in India and to everyone. Moving ahead to the next session, a few kind words and a patient listening can bring immense comfort and dignity to their lives. So our first session will cover the communication with elderly, and it's led by Miss Vidisha Bogain. I welcome Vidisha ma'am. Ms. Vidisha Bogain is an assistant professor in the Department of Social Work at Bhim Rao Ambedkar College, University of Delhi, and a PhD scholar at the Delhi School of Social Work. She holds a master in social work with a specialization in community development from Amrita Vishwas Vidyapeetham, with prior experience as a research associate on ICSSR sponsored project. Her work reflects a strong commitment to social welfare, research, and community development. I again welcome Ms. Vidisha Bogain. Over to you, ma'am.
Thank you so much, Kriti ma'am. Let me share my screen first. So is my screen visible?
Yes, ma'am.
Yes. So before I start with my presentation, I would like to thank CHIP Foundation for giving me this opportunity today and for inviting me as one of the speakers. So I will be talking about communication with elderly. So I've included very simple concepts in this presentation. And I hope in some way this presentation will give you some insights about communication with elderly. So let us first just understand the meaning of communication. So it is a very natural process that takes place between individuals or groups in a certain platform. And communication exactly means the exchange of information, ideas, thoughts, or feelings. And we have to understand one thing, that in order for us to be a good communicator, we need to remember certain points. And it does not only it is not only confined to the elderly population, but also it implies to almost all the section of the society or age group. So first, we need to learn to listen, and listen in the sense we need to learn to actively listen to the person. Second thing is know my audience. Obviously, if I am communicating with a group or an individual, I will have to know the person's background, from which background the person is coming from, the knowledge level of the person, and also the interest of the audience. So knowledge level in the sense if I, for example, if I've just taken a topic which is at a higher level of understanding, and and I am supposed to be delivering this particular presentation probably to a class group of class 6 or 7, and I have got concepts or matters that is of the university level. It is not going to make sense for the school going students of class 6 or 7. So I have to know what kind of knowledge level those my audience is having, how much knowledge they are having about the topic, and based on that I have to prepare my communication or the matter that I want to express, or the information that I want to give, right? And also based on the interest of the audience, I have to communicate. And next is organize and structure my message. Obviously, when I am in the field and I am talking to, I'm having communication with a certain group, I have to have a very organized and structured, way of delivering my message. It has to be, there has to be clarity. Of course, it has to be very clear and to the point, maybe, of what I want to pursue, what I want to deliver. Then it has to have a vivid language. Obviously, a language which is more understanding to the audience, and a language which is more comfortable. I have to keep that in mind. And I also have to maintain a certain rhythm while I communicate. And also here, the tone of the communication also comes in, which has to be maintained, which has to be balanced, right? And I cannot be breaking my rhythm or the flow while communicating, or I cannot be using a very high pitched tone while communicating. So all these certain things we have to keep in mind. And the last point of this particular slide talks about communicating is actually connecting. So a concept of rigid communication style versus a flexible communication style comes in. So obviously we communicate to connect, right? So if, for example, if we are following a rigid communication style, it will not help us. It will not help the speaker and the audience. We will not be able to, develop a bond or some kind of trust if we are following a very rigid style of communication. So it actually prevents a meaningful connection between the speaker and the listener. So it is better if we always choose a flexible communication style. This helps the speaker to convey the exact point, and at the same time it also keeps effectively, it also keeps everyone active and engaged. If we give that flexibility, if the communication is taking, since obviously communication is a two-way process, but yeah, when we give them the platform of some sort of flexibility, it also keeps the audience engaged, and it is just not one way where the speaker is speaking. So the second slide talks about certain principles of communicating with elderly. First is respect individuality. So here, being a student, or being a teacher from social work background, we do have certain principles that we follow. And one of the principles is a principle of individualization. So here we can put it in this way, that every individual is different from each other, and they have their own beliefs and their way of living and their life. So we have to respect every elderly person individually. And second thing is empathy and active listening. Obviously, we have to be more empathetic. Principle of empathy we have to use. Instead of sympathizing with the person, we have to understand the person, and we need to understand the perspective of the elderly. And active listening, like I've said, active listening also like creates a huge impact on the elderly, which I will talk about in the coming slides. Listening is different and active listening is different. When we actively listen, we make sure we understand. We try to like keep in mind about almost like 90% of what is being said. And probably half the time, most of us, we tend to listen more than actively we try to listen to somebody. So I think we must follow the principle of active listening also, and especially when it comes to talking, especially when it comes to communicating with an elderly. This is very important, because this also makes sure and gives them a sense of like sense of like secureness, that there's somebody who is listening to me, there's someone there who is ready to listen to me and kind of acknowledge my thoughts and perspectives and feelings. So, so third principle talks about use of strengths perspective. So this principle basically we have to keep in mind when we are communicating with an elderly or a group of elderly. Instead of focusing more on something which like the problems, or something which is of depressive nature, or the kind of problems that they have in life, obviously, which is also important to address, but I think we must focus more on like talking about the strengths perspective, like the strength that they have, their stronger points. And if we do so, they are also like happy, they can be more engaged, and they we make them realize that these are their strengths, and they can focus more on that rather than like focusing more on the problems that they have in life. And fourth principle talks about move at their pace. Yes, we have to understand this. But not all probably, but majority of the elderly, what happens with aging, they tend to become a little slower in life. Probably it could be because of the physical aspect that is related to it. So it is very important for us in terms of like the physical or the mental, that we have to move at their pace. And of course, like sometimes it takes time for them to process or comprehend certain concepts and information. So I think when we move at the pace and give them the time for them to like understand and then process the information and then come up with their responses, this we have to like give them this much respect, and we have to move with their pace. And fifth principle talks about the ensure accessibility. Yes, this is mostly in terms of like the physical aspect. Like some of the elderlies might be having vision issues or hearing impairment. So we have to ensure that like while communicating with them, if all the accessibility for them to like attend the session or have the communication properly, we have to ensure that they are having the accessibility without any issue. Then avoid elder speak. This is also very important. We cannot be baby talking to the elderly people. I think it is always best to talk to them with a very simple and like very normal and formal tone. And sometimes obviously like we need to be laughing also, we need to be having fun also, keeping everything in mind. We must avoid elder speak, and and like focus more on like being more simple while communicating with them. Then utilize verbal and non-verbal cues, which is again very important. In verbal cues, we have to maintain certain, like I've said, that we have to be very clear, that we cannot be using high-pitched tone, and we cannot be using very, ambiguous words or sentences. We must focus on keeping things very simple for them to understand. And we must also keep in mind that, we must use the best comfortable language that they would like to have the conversation or communicate with. And non-verbal cues, again, this is very important. If we are having a very rigid or, firm posture while talking with them, that might not give them the opportunity to like open up properly. So maintaining a very good or maybe open posture, or having certain hand gestures while speaking with them, making like ensuring them of the fact that yes, like I am understanding you. So these are certain non-verbal cues that we have to keep in mind, while verbal and non-verbal cues we have to keep in mind while we have conversations with elderly population. And eighth principle, involve the client in decisions. This is actually very important. After a certain point in life, after their retirement, and when they are like at home, not being that productive, it actually affects them. Physical problem, of course, at times will come along with the biological aging process, but at the same time, the keeping their emotional or the mental aspect a little active, it is very important. So I think it is very important for us to like involve the elderly population in decision making process, especially in terms of like if they want to like make a decision, if it is something related to their own life, and sometimes of course the family also, in family also. So involving them here is also very important, so that they do not feel isolated and they do not feel not productive. So these are the certain things we have to keep in mind. And ninth principle, here I've put, is use diverse communication method. Yes, sometimes what happens is we have to use different methods of communication. Probably simply like maybe speaking with them might get kind of boring to them, and sometimes if their elderlies are having some kind of like impairments, and like communicating with them in some sort of like audio format or visual format might not be helpful, so it's vice versa. So we have to use different methods of communication in a fun way more, or maybe like sometimes we can take help of the visual devices also to show them some videos, and if we want to give them some information. And also sometimes we can do some sort of like activities with them, like coloring, poster presentation, etc., for them to to make the communication pattern more fun for them. So this slide talks about effective communication with elderly. So some of the strategies of effective communication is importance of patience and active listening. Active listening, I have already touched this topic. So patience, of course, like I've said, we have to go, with their pace of understanding, communicating. So we must have patience while talking to the elderly group, because they tend to slow down after a certain point in life. So we must have the patient levels. Then encouraging autonomy through questions. This is also very important. So this basically talks about, we must give them the autonomy through questions. For example, if they've shared something with us, we must ask them more questions, so that they feel that yes, we are understanding and what they're sharing is being heard. And this is how they feel independent, and they tend to share more. So this is also very important. And just because someone has attained a certain age in life, it should not be like, okay, now you are not not that productive enough, or you should not be speaking more. That should be avoided. Instead, we should encourage more independence, and then more autonomy through different questions, ask more questions, so that they can take, actively they can participate in it. Then comes the maintaining calmness and respect. Obviously, at times it might be very difficult to, to deal with certain elderly. It is not, I'm not generalizing it here, but yeah, specific cases. So understanding what from where the elderly person is coming from, we have to maintain our patience and then calmness. And of course, we have to respect the elderly instead of being very, aggressive, or not, what do I say, like being demeaning. I think it is always best to be respectful enough. And when you give respect, I'm sure the the elderly person will also feel respected, and will revert back, or will respond back properly. Then promoting collaboration through I statement. This is very important. Instead of like questioning them, like, for example, why you have not taken the medicine. Instead of that, we can probably put it in this way, like, I have noticed that you've not taken the medicine yet, and I hope you will take it. So when you put I, it gives them some sense of like, okay, that somebody is there and who cares for them, right? And instead of questioning them that, why you have not taken, why you have not eaten, we need to more, like, often we need to use I statements. Then next is enhancing communication in healthcare. This is also very important. This I will not be taking much time here, because I'm sure like there is one of the speakers here with us today who will take up this sector more properly. But yeah, certainly like addressing age-related sensory changes. Obviously, with age, they do come up with certain changes physically. For example, visually they might, have they may have difficulties, and mihearing impairment also can be one of the issues. Or maybe like, feeling or touching certain things might be, the sensory motors also might decline, might deteriorate. So these can be addressed while by taking certain assistive help of certain assistive devices, for example hearing aid, or spectacles, and then probably doing certain sensory motor skills like hand movement, leg movement. So these are certain things. This is how we can enhance communication in this way. Then involving family caregivers in conversation. This is very important. Family caregivers in conversations, we have to include them, because whatever the issues or whatever is happening with an elderly person, I think the family caregiver has to know, because it makes a lot of like difference. And considering some of the if I just talk about some of them might not be having family, because they are put into the elderly old age home and all of that. Even there, the immediate caregiver, whoever is there, I think their involvement also matters a lot, because that gives a sense of like belongingness within the family, and that closeness and the loved ones, so that remains intact. Then tailoring communication for health improvement. Like I've said, keeping in mind about the principle of individualization, whatever issues elderly population are having, we must tailor, like healthcare treatments or be it conversations according to the individual's issue, and not and we should not generalize it that elderly A is having this issue means elderly B and C is also going to have it. No, it may be different cases with different elderlies, right? Then leveraging non-communication skills, like I've said, alongside verbal communication, it is important for us to use non-verbal communications in terms of like nodding and like showing facial expressions and gestures. That's going to be more what do I say? The fact that they're here, that will be more that we are here, that we are listening to them, and this will be enhanced. Next is overcoming communication barriers. Again, this is here, like I already mentioned, age-related, coping with vision, like I've already said, coping cognitive decline. This we need to take it like at their pace, because comprehending certain information might not be the same for them and might take some time. Yeah, so we have to be patient, and like we have to have a calmness. And then bridging generational communication gap. This is very important. So nowadays, if you see like every generation, something or the other, be it technological aspect or the way generations perceive things now is very different from generation to generations now. So I think bridging generational communication gap is very important. We must try to like create or have more sessions, awareness sessions, or like maybe like some sort of like fun activities, and we must include almost all groups of like people coming from different age groups. We must mix them, and we must have the session that will bridge the generational communication gap among the elderly group and the other age group people. Then addressing language and cultural barrier. This is also very important. If we have to keep in mind while communicating, the language that we use has to be very simple and clear, like I've already mentioned. And cultural barriers, of course, like it is important that we try to mix more, like we talk about certain cultural norms and values of different cultural backgrounds. And then we must create a platform where we can, bring the elderly people coming from different cultural backgrounds so that they can all sit together, have conversations, and have do certain sets of like activities. So this is also very important in terms of that. Some of the very practical communication techniques are active listening, I've said, then reflective responses. This is basically when, for example, when an elderly have shared something with us, for example, with me, I have to show some sort of like reflective responses, in the sense like, what was being said to me, like I have to acknowledge that and probably put it in my own word or add on to it. That gives them a sense of like, that yes, this, but I have listened to the elderly person. Then importance of nonverbal cues, simplifying language for clarity, empathy and validation in interaction. Yes, we have to validate their perspective, their whatever they have shared. So this has to be done. And encouraging seniors in decision making, this I've already mentioned. So this is the technological solutions for communication. Obviously, now if we see our grandparents also, they find it difficult to use the mobile phone or or a laptop, even to operate the television. So I think but nowadays there are different apps which they can use, and also I think the technologies that are equipped nowadays are very handy. They have this the speaker mode also. You just have to like either call the Siri or the Google Assistant. You just have to like speak it, and they are there to like to reply to your queries or whatever information you want to ask. So technological solutions are also there, and this can be done through various apps that has been developed for the elderly person in almost every sector. So like I've said, impact of active listening, this is
Vidisha
very
ma'am.
important.
Vidisha,
Yes.
sorry for
Yes.
sorry, but can you please sum up your presentation?
Yes, sure. So obviously, impact of active listening, it recognizes changes in communication habit. And basically, when we actively listen to an elderly person, it helps them, to be more happy, and somehow it contributes to their overall well-being, and they tend to become healthier and happier. And that's because there is somebody who is listening to them, and they think that yes, they're not boring enough. They think that they are not probably like they're not productive or something. They don't think all of that. So we have to acknowledge that, and we have to listen to them actively. Probably this is the last slide that talks about the key benefits of effective communication. So what actually it does, when we listen to them, it builds trust and rapport. Obviously, they might not want to share, or obviously do not want to trust us at one go, right? So with the process of rapport building, they will eventually have trust in us. Then obviously improves health and well-being, because we tend to understand the issues, that probably we can come up with a very much tailor-made interventions for their healthcare and well-being. Enhances independency, because they become quite active and they tend to share more, and become more active and engaged in the societal activities also. Then promotes accurate assessment. Yes, when we get to know elderly people, we then can come up with certain sort of like accurate assessment based on their histories and everything. We get a better idea to assess them more properly. And obviously it helps manage like complex issues, because we communicate with them, we listen to them, we listen to their problems, and whatever they want to share it with us, we are there to listen to them. So this is how it also helps manage complex issues. So this is all I had to like share. So and I hope you were able to like take some insights from my presentation. So yes, Kirti ma'am, over to you. Yes.
Thanks a lot, Vidisha ma'am. Thank you for highlighting effective communication with the elderly that helps them feel valued, respected, and emotionally connected. Thank you. Now
Thank you,
coming to
ma'am.
our next session, that is on safety of elderly, and is led by Ms. Samiksha Suri. Ms. Samiksha Suri is Assistant Professor and PhD Scholar at University of Delhi, who will highlight practical approaches for effective communication and ensuring elderly safety. Over to you, Samiksha ma'am.
Thank you, Kirti ma'am. I hope I'm audible and my screen is visible to you all.
Yes, ma'am. You are audible and screen is also visible.
Yeah. Give me a second. Yeah, yes. So thank you. Firstly, thank you, CHIP Foundation, for having me and giving this opportunity to give my insights on a very important topic. And I'll be covering on the very important aspect of elderly, and that is elderly safety. So when it comes to elderly safety, we all know that the population of elderly, especially in regard to aging, 80% of the developing countries will be elderly by 2050, and this statistics is very concerning because this will the percentage of older person will be increasing, and so does the problems when it comes to elderly safety. And why does it matters in India? We need to look upon certain aspects. Those are rising cases of elder abuse, the neglect that they face, the isolation, and the loneliness that they suffer. The other aspect is because of the migration and urbanization, it has led to weakened family support system. And thus, we need a very strong social, community, and policy based safety measures for the elderly. So, there are many problems that the elderly faces. We can talk about morbidity and mortality that go up with the age. There's greater vulnerability among this population. In today's time, the stress that is associated with the impact of rapid social change and the decline of the extended household, it has impacted on elderly, right? So there are certain challenges that we need to look upon in today's society in contemporary times. If we look upon the challenges, I want to ask the audience, what do you think? What do you think about the challenges that the elderly faces in these modern times and contemporary times? Anybody want to answer this question? The modern and the contemporary challenges faced by the elderly. Anybody wants to come up with a point? So as you can see in the screen, I have come up with very new aspect of the challenges that is basically faced by the elderly in today's time. When we talk about the changing values of the elderly, we say that it appears that the society as a whole, particularly in urban areas, if we see, is headed towards a very self-centric society. So the concern for others as a hallmark of Indian society is decaying, right? So the impersonal approach of current society, it possesses enormous danger at all levels because the values have changed. The connection among the households, among relatives, among family members have changed. So this change in the societal values is one of the most important challenges that the elderly are facing. The next would be the growing scarcity of caregivers. Caregivers, they are becoming scarce because of the increased mobility and migration of the young population to the cities. The changing roles and the expectations of this generation, especially if you see, it is about the concerns of privacy. It is about their career, their ambition, and the employment outside home. And because of that, there is a scarcity of caregivers. The another challenge would be scarcity of space and needs. So there's a very limited space in the house, and because of the increased number of family members, it has given rise to the new patterns amongst the aged. So these needs can be, if we see the needs of the elderly, we can broadly classify them as nutrition needs, psychological needs, social needs, needs of special groups, health needs, and safety and security needs. So these challenges are coming up in the recent times. Now, if we also look upon the institutional support to the elderly, so regardless of the economic status, people from all walks of life, they need institutional support, right? So in case of their caregivers, if they have migrated and settled anywhere, settled elsewhere, and they fail to provide the requirement support, the nature of support cannot be same for all sections of the society. So we have to understand, like for example, for those who are economically well off, only the service of well trained caregivers is needed. But for those who are poor and they're not able to bear the cost of caregivers, and their children have migrated to the cities, so they can hardly able to meet their own requirements and essential needs, right? So that is why the challenge comes of the institutional support which needed to be addressed. Another challenge would be the planning for productivity in old age. So the aged people who are not gainfully engaged are considered as unproductive. So these unproductive elderlies, particularly belonging to the unemployment sector, it becomes further miserable for them, right, to plan their productivity. So some of them even want immediate separation and share from the property. So therefore, proper planning for productive during old age is very important, and it is one of the most important challenge in today's time. So I have addressed some of the most important contemporary challenge, and if we find a way out, if we can come up with a inclined or solution for the safety of the elderly, the concept of healthy aging and active aging plays a very important role in this. To tell my participants, the United Nations General Assembly, they have declared the decade of healthy aging from 2021 to 2030. Right? When we talk about healthy aging, what is it? It is the process of developing and maintaining the functional ability that enables well-being in older age. As we know, a longer life implies that the old person is being given another opportunity to pursue new avenues, to pursue education or passions, whatever they feel like. So when it comes to the concept of healthy aging and active aging, I have divided this into very broader three categories that we need to address basically. So the first category, the first component of healthy and active aging would be functional ability. What is functional ability? It is about the capabilities that enable all the people to do whatever they want to do. Have connections, go out, do work, go for institutional support of family gatherings. So this component is very important when it comes to healthy aging and active aging. The next would be intrinsic capacity. So intrinsic capacity, it comprises of all the mental and physical capacity that a person can draw on, and it includes their ability to walk, to think, to see, and to hear, and most importantly to remember. So this is a very important aspect, and we need to address this aspect in relation to the healthy aging and active aging. The last would be environment. See, environment, it includes our home, its community, and broader, in a broader way, we talk about society. So all these factors within them is infrastructure, people, their relationship, their attitudes, their values, the social policy. So these three approaches, functional ability, intrinsic capacity, and environment, this will make a wholesome package of healthy aging and active aging which needed to be addressed. Now, there are certain policies and programs when it comes to safety of elderly. We all have heard about the National Policy on Older Persons. It was introduced by the Government of India in 1999, and it addressed the economic capacity, development, effective provision for the elderly population, right? There are other policies also, like National Program for Healthcare of the Elderly. It was launched by the Ministry of Health and Family Welfare, Government of India. The objective of this policy is to provide accessible, affordable, and dedicated healthcare to senior citizens. It also helped in strengthening the healthcare delivery for all the elderly at all levels. The major objective was to build capacity among healthcare professionals. Then I have also included some of the new policies that are introduced, like Ayushman Vay Vandana card. You know Ayushman Bharat. So in that scheme, the card by introducing a Vandana card, this scheme has offered a free medical treatment cover up to the 5 lakh per year for citizens aged 70 plus, irrespective of any income or financial status. The another scheme would be Pradhan Mantri Vay Vandana Yojana. It is a pension scheme for senior citizen that offers a guaranteed monthly income. Next would be Rashtriya Vayushri Yojana. It provides assistive devices like walking sticks, wheelchairs, hearing aids, free to seniors who are below poverty line and have age-related disabilities. So these are kind of safety measures and safe and protective schemes that have been built by the government, that have been provided by the government for the safety of elderly. Now, in the end, I want to talk about the measures. When it comes to safety, we need to discuss about certain measures to promote care for elderly, right? So when we talk about today's society, the most important aspect comes to children awareness of old age care. So school children especially, they need to be educated about old age and old age care. They need to be sensitized to the need of old people and their contribution to family, society, and community. Next would be youth preparation for old age care, which is very important. See, education regarding care for elderly, youth need to be sensitized about old age care. They need to be explained that genuine denial to the basic needs of elderly can put them under punishable circumstances legally as well as socially. So it may deprive them from natural inheritances as well in certain cases. So today's youth, they need to be sensitized about old age care in both aspects, in legal aspects, so they don't misuse their power, also in social aspects. Now there's empowerment of generating knowledge. So to empower elderly, it is very crucial that cost-effective approach of managing the needs of elderly, such as health, nutrition, social and economic security is provided. When we talk about the next aspect, that is public-private partnerships, see, we have learned that the government initiatives remain inadequate if the partnership with the private organization or NGOs is not appropriately inbuilt into the system. So therefore, involvement of public-private partnership in developing the capability of elderly people needs due recognition under the various policies of the government. We also need to focus on the vulnerable elderly people. We need to provide a special focus on those vulnerable groups of people suffering from multiple problems. So while designing the healthcare services for the elderly, special emphasis can be given to the oldest of old group of people who remained neglected in all sections of society due to various reasons. We need to also promote senior citizen associations, which are continuously growing, but they have to be emerged on their own. They have to be based on the general needs felt by groups of older people only. The last would be the capacity building of NGOs. NGOs are recognized as strong partners to government institutions, from village to state levels to national levels, which are implementing development programs. So there are national and state level NGOs, and officials from these NGOs need to be given sensitization about the commitments that the nation has made to respective ministries under national policy on older person. So NGOs can turn and take up the role of training of middle level and field level people towards sensitizing the special needs of the aging people and towards the healthcare of the elderly. So this is all from my side. I hope you are able to get the information that is needed. Thank you, Kirti. I hand over to you now.
Thanks a lot, Samisha ma'am. Thank you for guiding us on safety of elderly. And of course, a safe environment allows them to live confident, comfort, and peace of mind. Thank you. So coming to next session, which is on aging and elderly care, that is common medical and social issues, presented by Dr. Akash Jaiswal, to offer the valuable insights into medical and social challenges of aging. Dr. Akash is currently working as consultant geriatric medicine at Fortis, Gurugram. He did his MBBS and MD in geriatric medicine, both from AIIMS, Delhi, and he has worked as a senior resident in National Center for Aging in AIIMS, Delhi. He conducted health talks, camps, awareness sessions to help senior citizens be more health aware, along with routine clinical practices, and thus helping them achieve healthy aging. So thanks a lot for joining the session, Akash sir. Over to you.
Thank you, Kirti, for the nice introduction. Thank you to the CHIP Foundation for inviting me on this very important discussion which we are having about the senior citizens and geriatric age group. And I would like to talk on the medical aspect, or the how we as a clinicians are taking care of elderly population, what are the important aspects which we have to take care of, and how it is different from routine clinical care. So, as already discussed, uh, we all agree that the aging population or the elderly population is going to increase from about more than 10% currently. We are expecting it to rise by 20% by 2000. It rise to 20% by 2050. And also longevity is increasing. So more and more population are going to be in this age group. And how we have to make them promote healthy aging is still a challenge. When we talk about elderly care, it's not as from a medical doctor's point of view, it is not just medical. We have to take care of their emotional needs, their social issues, and also how independent or how functional they are. Because without functionality, healthy aging cannot be achieved. Just discuss what are the physiological changes which happens with aging and how it impacts different, how it complicates taking care of an elderly patient. We all know as we age, our muscle mass decreases. And after especially menopause or after a certain age in males as well, bone density also decreases. And this decrease in muscle mass at times lead to poor muscle strength, poor muscle function, which can lead to fall, which can lead to poor functionality. And falls more often or not leads to fractures. Now, frailty, I will discuss later, is a syndrome in elderly which leads to increased poor outcomes in them due to accumulation of different health-related or physical uh, ailments throughout their life. In a similar way, vision, hearing is also decreased with aging. Memory, cognition is also takes a hit. When we talk about our organ reserves, especially renal, hepatic, and cardiac reserves, especially renal, if we talk about, with after the age of 60 years, every decade there is some decline in the GFR. So there are a lot of complication which happens with it. We have to modify the different doses of drugs and certain medications which patient is already on cannot be given now because of this decreased renal or hepatic dysfunction which happens with age as well, and not necessarily due to disease. this metabolism, this enzyme metabolism in their body also decreases with aging, and this leads to slower drug metabolism. And at times we have to give more medication. These more medication to counteract it, we have to give more medication, and that leads to polypharmacy risk, which we will discuss how it impacts poor health outcomes in our elderly population. Immunity decrease leads to increased infection risk, and most often we have seen infection is the most common cause of mortality and morbidity, acute, especially in elderly population. If we discuss about the common medical issues in the elderly population, chronic diseases remain at front. And more often or not, a lot of elderly populations have multimorbidity. Multimorbidity means patient is having more than or equal to more than more than one of these chronic diseases like hypertension, diabetes, hypothyroid, or any heart diseases, any lung chronic obstructive pulmonary disease, arthritis, or anything like that. Now, then, apart from these chronic diseases which patients, takes from their adulthood or later adult life, there are few specific conditions which happens only in the elderly population, like falls, which are not seen in the young adults or even in the till 50s or 60s, very rare for patients to have falls. But when we talk about falls in a later life, there is a data that after the age of 65 years, in a year, 3 out of 1 individual at least develops one fall in a year. Similarly, incontinence. Incontinence can be both urinary incontinence or stool incontinence. Mostly it is due to urinary incontinence. Both male and females are affected with that. Cognitive decline or dementia issues is also very specific to this age group. Frailty, as I discussed, is a syndrome of increased poor outcomes due to accumulated health-related aspects, health-related problems, and decreased intrinsic capacity with aging. In a similar way, depression. Now, I practice in Gurgaon. There are a lot of elderly population who is living here in high-rise societies and even normal societies who are living alone. Their children are mostly NRIs who are living in foreign countries. So it's basically the husband and the wife in their late 60s, 70s, 80s living alone. Now, all these, increases the risk of depression in elderly population. And most often or not, after the post-retirement, again the risk of depression increases, or due to any multiple chronic health conditions, or maybe diagnosis of some serious health conditions like cancer and all also increase the risk of depression. Delirium is a condition of acute confusional state which happens due to multiple reasons, medical issues. Sometimes it is due to drugs, sometimes it is due to electrolyte imbalance, sometimes it is due to minor infections as well, like UTI. And we have seen patients due to pain also having delirium, and at times it leads to hospitalization. Polypharmacy is use of more than or equal to 5 medications, more than 5 medication by the individual. And it has seen that when patient is having polypharmacy, it leads to adverse effects. It leads to increased risk of side effects from those drugs. It leads to more decline in the organ dysfunctions. It increases the risk of fall. It increases the risk of dementia or delirium. Malnutrition again is a very common issue in the elderly population, especially in our country, because a lot of patients still have myths around surrounding how much protein they should take, what are the essential diet they should take, what all they should monitor from the point of view of their micronutrients deficiencies shouldn't take place. They might have dental issues, which happens with aging, or due to some social neglect as well. This malnutrition issue is also very common. As we were discussing, this is the data from the NSSO 52nd round. A lot of more than 75% individuals, older adults, suffer from at least one disease. 50% suffer from one chronic condition. 20% from 2 chronic conditions, and 3% have more than 3% have 3 chronic conditions. Now, this is an old report. The new reports may show that even more number of disease or comorbidity burden now. In a similar way, at times chronic stroke or any neurological conditions or maybe joint or muscle related issues may lead to some disabilities as well. And that is also increased or seen more in the elderly population. Now, this is a relatively newer data from the longitudinal aging study from India. And it just shows that above the age of 60 years, what are the most common comorbidities or prevalences of these common health problems? So, cardiac diseases or coronary artery, these cardiovascular diseases constitute a major chunk of these comorbidity burden, followed by hypertension, diabetes. Bone and joint disease is also seen very commonly. In the sensory system, vision related issues are very common. Oral health related diseases due to dental issues or due to chewing of tobacco or smoking, oral health related diseases are also very common in the Indian population, especially in the rural area. Fall prevalence in India has shown to be 13%. In Western population, data has shown more. Maybe it is less in India or it is underreported. That needs to be seen. ADLs are our activities of daily living limitations are seen in 30% of the population. And instrumental activities of daily living limitation is seen in 40% of the population. Now, we specifically discuss cognitive and the mental health problems. Dementia, as we know, dementia is progressive decline in memory. And when we call it dementia is when your forgetfulness or your cognitive slowing starts impairing your day-to-day activity. If it is impairing your day-to-day activities, you are forgetting things which is happening in your day-to-day life, we call it dementia. And dementia prevalence is around 7 to 8% in currently in India, and it's more in the Western population because their population is more aged. And dementia is a very serious issue because it not only affects the person who is affected, the caregiver and the caregiver burden is very much high in this dementia population. Again, at times the financial burden due to caretaking of such patients is also very high. Depression, as I discussed, as a clinician, as a geriatrician, when a person comes to us, we often actively ask how are their mood, how they do feel, are they doing the activities which they earlier used to do, is there any crying spells or any thoughts of negative thoughts are predominant in them, because at and we actively screen them with geriatric depression scale as well, because depression prevalence by the LASI data which I was going through is around more than 30% in this elderly age group, and is a very common issue. And at time, depression is late life depression is a risk factor for dementia. And if we don't correct depression in the late life, then it has multiple problems. It can lead to malnutrition, it can lead to dementia, it can lead to poor health outcomes. In a similar way, we discussed delirium is a very serious health issue and at times not very well managed and at times misdiagnosed. Delirium is an acute condition and any acute confusional state which is not chronic. If a person is having chronic, forgetfulness and is slowly forgetting, and over the period of 5 years, 10 years now, he is not remembering things. But delirium is a person is was doing well, but suddenly is having this acute confusional state. It is not dementia. It is most often due to some acute problem, and that more often or not, it is correctable. It is treatable. It can be due to an mild UTI, it can be due to pneumonia, it can be due to certain drugs, it can be due to pain, it can be due to change in the environment at times. So we have to be aware about this thing as well. So mental health is integral to geriatric health. And as a geriatrician, when we take care of our patients, cognitive and the mental health is one of the most important area which we take care when we see our patients. Now, the second important thing is, as we see in our LASI data as well, that falls is seen in 13%, joint related issues is seen in more than 25%, and fall can have a catastrophic effect on an elderly population. Now, just imagine, I see a lot of patients that who have never went to hospital, just they had fall, they developed hip fracture. Now, due to that hip fracture, they have to be hospitalized, maybe in ICU for some days, they had to undergo surgery. That shakes them up. That, that decreases their confidence. And at times they develop fear of fall. Now they don't want to go out on their own. Their mobility is restricted. At times, their functionality is restricted from them. And then we are taking care of patients for fall with fracture. At times, patients who have already have comorbidities or some other issues, they tend to develop more complications from these falls and fractures as well. But these falls and fractures are preventable. So fall risk assessment is essential in an elderly population. We have to look for their vision. We have to look, there is no vertigo or dizziness. Their hearing is normal. They are using hearing aid if it is required. A geriatrician or a neurologist will check for their, gait. There is no abnormality in their gait. There is no neurological, there is no peripheral neuropathy, or there is no muscle weakness or gait imbalance which needs to be taken care of. In a similar way, certain drugs increases the risk of uh, fall. So we have to take care of those things as well when we see an elderly population. So to prevent it, we generally tell them we do the drug review, remove the unnecessary drugs. We do their home safety points. We tell them ideally a home safety survey should be done. And we ask them to do physiotherapy and with strength and gait and balance exercises. Now, functional assessment is also very important because with poor functionality, healthy aging cannot be achieved. And when we talk about functional assessment, ADLs and IDLs, if the patient is able to maintain or not able to maintain, we have to ask our elderly population, a patient when they come to us, if they are not able to, again we have to do a proper assessment why it is there. Is it due to cognitive impairment? Is it due to physical ailments? We have to correct it. Is it due to some sensory issues like vision or hearing? So we have to correct that. We have to involve them into physiotherapy with lower limb strengthening exercises, gait and balance activities. We have to provide them home support as well. We have to provide them proper aids if they require, like walking aids or hearing aids if required, so that they can maintain their life independently and with minimal support. The other important or very common issue which we face, especially I think in India, there is too much prescribe, prescribing of drug is seen, and at times patients also tend to take over-the-counter drugs, or they tend to go to multiple super specialties, some prescribing, maybe there is some overlap of medicines as well. And as is seen by this graphics, that the risk of adverse event increases. If there are two medications, there's chance of 13%, with five, 58%, and more than seven, 82% risk of adverse effects are there. So as a geriatrician, we have to do a thorough drug review and we have to reduce the unnecessary medicines. We have to remove the potentially inappropriate medicines. So there are certain medicines which shouldn't be given to an elderly. There are certain diabetic medicines, there are certain hypertensive medicines which shouldn't be given to an elderly due to risk of side effects. In a similar way, pain medicines which are safe, that has to be given. And not just that, a medicine has to be taken for how much duration is also very important. And we see a lot of patients that it was prescribed for 1 month, but they are taking it for a longer period of time. Like a simple medicine, pantoprazole, I think a lot of you must be aware about it. Acidity medicine, if taken for more than 8 weeks, it leads to, it will be very difficult to stop it due to reflux hyperacidity. And also, if taken for a longer period of time, it can lead to decrease in the bone density. But I see a lot of patients taking it for a longer period of time. So that is also needs to be taken care of. I think there was a talk on communication skills and also social aspects, how to take care of elderly. I think this topic was already covered, but as a geriatrician, I want to tell that yes, we also look for these issues in the elderly population, whether they are isolated, whether they do need counseling, whether there is any mood related issues in them, we have to take care of it. At times, we ask about financial help as well, and we connect them to the NGOs and the social security officer at times. When I was at AIMS, there was a special MSSO office. We tend to refer them to them so that they can even help them financially. And if they can provide help with certain health benefits, which is provided by the government, but they are unaware of. Elder abuse is also very common, not so in the well, affluent populations, but the population in the lower socioeconomic group, yes, it is more common. So we do screen for that as well. If we see signs of social elder abuse, we do, refer them to these NGOs, and they take care of it further on. So that has to be taken care of as well. Now, the other important aspect is caregiver burden. As I discussed, due to these multiple health challenges which elderly face, and especially in cases of dementia, the caregivers, especially if there are family members, it becomes so, physical, emotional, and financial burden all is there on them. So, are they taking care of them? So, we do caregiver counseling as well, so that they are also taken care of. They are able to enjoy their life. They are taking care of their health and not just focusing on the patient, like the dementia patient or the elderly patient. So that also we have to take care of. And also more infrastructure or more system have to be developed where we are actively asking the caregivers as well how they are doing and provide them support, and maybe provide them some sessions where different caregivers sit together and share their experiences. So just to summarize how we approach an elderly care, so we do a comprehensive geriatric assessment to any elderly who walks into our clinic. In a comprehensive geriatric assessment, we, apart from the medical issues, the different comorbidities which are there, we tend to look at their functional status. We tend to do the fall risk screening. We take care of their bone health. We take care of we check for their cognitive abilities or their memory, how it is. We take care whether there is no depression or anxiety in them. We ask for their social support. We do tend to ask them about how financially viable they are to support this current situation which they are facing. And where they live, there are no health hazards, like especially in fall cases or the patients who are more prone for fall. A home survey for fall risk assessment should be done. And the goal of our treatment is simple. We want them to be independent. We want them to be function and have a good quality of life, more than just curing or taking care of their diseases. And this is a team-based approach, which as a geriatrician we do. And there is the involvement of nurses, there is involvement of physiotherapists, psychologists, and social work. This is the healthy aging plan, which involves consultation with a geriatrician for CGA. Then we have to correct and preserve their intrinsic capacities. We have to involve them into exercise, yoga, and tell them about the specific diets and how much protein they need to take. And we should be able to, counsel them for each aspect. We have to manage their comorbidities and tell them how annual health checkup and once a year a visit to a geriatrician is also very important. Elderly vaccination is still very under penetrated and is still not included in the national immunization schedule, and not very penetration is very poor still for vaccinations. And polypharmacy and drug management are again important. So to develop geriatric services, not only at the tertiary care or in the big cities, I think most of the geriatric care is still focused in the very big cities and not in the tier 2 and the tier 3 cities. From the insurance point of view, inclusion of the 70 above the age of 70 years in the Ayushman Bharat was a welcome step. But I think all other insurance, private and the public insurance, should also include, elderly population, and they should be able to take health insurance even in later in life. And community-based care will be the way forward as we move ahead to take care of our elderly population. And more number of healthcare workers needs to be trained in geriatric principles. So thank you. That would be all. Kirti, you can take over.
Thanks a lot, sir. Thank you for highlighting the common medical issues and social issues as well. So now we open the floor for questions from our audience and students, please.
Hello.
Yeah.
Hello. Yeah, I'm Kashish, and it was a nice session on geriatric
medicine and geriatric care, I would say death is inevitable. And with some geriatric population being emotionally and intellectually strong, but still some have their physical diseases, some mental issues, and social communication things. So there has to be an apprehension to death, even in someone who is sick or somebody who is diseased or even somebody who is normal as a part of aging process. So how can I as a daughter or a granddaughter, how can we as citizens can look after this issue, and how can this be seen, because this is not very easily told that by the patient or by a geriatric population, by a aging population, that there is an apprehension to death.
So I request Dr. Akash to answer the Kashish question.
Can you just repeat the question again?
The geriatric population has obviously an apprehension to death somewhere or the other, because obviously it's an aging population. Death is inevitable. So how can if such questions are there in a geriatric population, uh, maybe due to the physical illness or mental illness or social communications, how can this be catered to? Like, they are near their death, like they have this apprehension always, especially those who are physically ill, someone suffering from cancer, someone going through some mental trauma, somebody losing their partner. So how can this be dealt with? Like,
So it's again a
apprehension to death.
complex, yeah. So it's again a complex issue, and contrary to the I think our belief, but I think a lot of elderly do come to me and say that they are ready to go now, and they have achieved everything in life, they have lived happily, and they want to go. But if someone, yes, there are a lot of population who comes that they have maybe developed some cancers, some terminal illness, or maybe was admitted for a longer period of time in the hospitals. They tend to fear, especially if they have unfinished business. So in most of these cases, what we have to counsel them, that whatever time they have, that is inevitable, as you're saying, and it is the one and only truth. So we have to counsel them that yes, that can happen to anybody any day. But whatever time you're going to have, if you're taking care of certain things which we are going to tell you, if you're taking care of your health, and we will provide you comfort. We will make sure that whatever time you have, some we will take care of you medically, and of course there will be some family members around. We have to involve them as well, that they will be there to take care of you, and the last parts of your life won't be alone, won't be in misery. You will have a good life. And of course we have to involve the caregivers or whoever the close family member is there in this communication. It's a difficult communication, but I think that is the way we have to approach it. As a doctor, I think that is what I can assure my patient, that we will take care of, from palliative point of view or end of life care, that I will take care of, that you don't get any, discomfort, whatever time you have. What 2 years or 2 months, that I cannot predict or nobody can predict, but that is how I'm going to take care.
Okay, thank you.
Anybody else?
Yeah, I have a question to ask to
Yes.
Dr. Akash. Dr. Akash, with increasing use of digital tools, how can technology be leveraged to improve safety and engagement of elderly people? We have seen there are devices which are helping our elderly, to prevent their fall, to prevent the fire at their homes. So, have you been come across any other devices, such devices, which are helping our elders in their life?
Uh, yes, sir. So there are a lot of in the Western. In India, I haven't come across such devices yet. But as we read more and more research paper on geriatrics, there are a lot of research on wearable devices, which measures the patient's gait and at times, alert the, nearest healthcare facility or whoever they are enrolled with if they develop fall. Because as we know, a lot of these elderly population live alone. And at times they develop fall, they remain, in the fallen state. So this first thing is that if they develop a fall, signal will be sent to the caregivers, to the family members. So they have to wear it all the time. Any arrhythmias or anything else can also be predicted by that. And at times, for assessment as well, these wearable devices tells us about ambulatory BP, and more than that, their gait speed has that decreased. And there are a lot of research going on that a certain pattern of gait speed or certain wearable devices, certain technologies which by scanning speech are able to predict that these patients may have dementia or may develop dementia later in life. So they become our target population. They can be, picked up, and we can provide more focus on, assessing them or preventing these chronic health illnesses in them. Apart from that, there are pill, because polypharmacy is also very common. So there are pill organizers, which are also available in India as well. So that these elderly population, especially if they are living alone, their functionality is not that good or their cognitive capacities are not that good, we provide these different at what time they have to take walk, and they provide these pill boxes which they can, tear up and eat at that time. And they provide these notifications via WhatsApp or messages as well that it is their time to take medicines. So a lot of things are happening, and also in India, I think a lot of focus is there on geriatric care now. I think uh, from what it was 2 years back, a lot of people are interested in, investing and in, doing new things for elderly care.
Yeah, got it. Thank you for your response.
Thank you, Dr. Gaurav, for the invite as well, and it was a wonderful session.
Thank you. Thank you.
So, to conclude the session, I'll invite for the closing remarks by Dr. Gaurav Sharma, Consultant CHIP Foundation. Over to you, Dr. Gaurav.
Thank you, Kirti. Good afternoon, everyone. Thank you for being a part of today's insightful webinar on basics of geriatric care. And it has been an engaging and meaningful session, which, which helping us in reflect on medical, social, and emotional aspects of caring for our elderly. A very special thanks to Honorable Professor Dr. Ravi Mehrotra, sir, founder of CHIP Foundation, for his inspiring leadership and vision in guiding initiatives that bridges healthcare innovation and policy. His guidance continues to strengthen our mission of advancing healthcare innovation and compassionate practice. We are equally grateful to Dr. Tusti Bharadwaj ma'am for her thoughtful opening remarks, highlighting the importance of social awareness and sensitivity in elderly care. Uh, our heartfelt appreciation to Ms. Bidisha and Ms. Samiksha Suri for their engaging session on communication with the elderly, a skill that lies at the heart of compassionate caregiving. Here I would say that, all important verticals, how we can effectively communicate with our elderly, was explained in a meaningful manner. Uh, our special sincere thanks to Dr. Akash Jaiswal for his clear and practical insights on the medical and social challenges of aging, which truly enriched our understanding of holistic geriatric care. Here today, we have learned from his teachings that, what are the physiological changes which our elderly faces, and also what are the common and important medical issues faced by our elderly, explained with eye-opening statistics, alongside highlighting the burden in India. Special attention was made to the cognitive mental health problems, how prevalent they have become, and it which actually necessitates to address this issue. And also he has provided us with a very important thing, healthy aging plan, that I could see is very helpful for our participants, for the caregiving of their elders. So geriatric care is critically important for society because it addresses the unique and complex health needs of a rapidly growing aging population, promoting their functional independence, quality of life, and overall well-being. So by managing chronic conditions, preventing disabilities, supporting mental and social health through a holistic person-centered approach, geriatric care reduces healthcare system burdens and empower older adults to live with dignity. This specialized care also support families and communities, enriching social cohesion and sustainability as population age. So today's discussion has reminded us that caring for our elder goes beyond medical treatment. It is about compassion, patience, and respect for the dignity at every stage of life. So, on behalf of CHIP Foundation and Project Eco India, we thank all our participants for their time, attention, and active engagement. Let us continue working together to build a more responsive and a humane system for elderly care. Thank you once again. We look forward to your participation in our upcoming sessions. Thank you. Thank you, everyone. Thank you for your time and patience. Good evening.
I
Over
thank
to you,
you
Kirti.
again to my speakers to join in very short notice. Dr. Thushti, Dr. Samisha, Vidisha ma'am, Dr. Akash, thanks a lot. Healthy aging is not about a number of years we live, but the quality of life we lead. We hope this webinar inspires each of us to contribute towards building a more compassionate, informed, and age-friendly society. Thanks a lot for joining us. Stay ahead. Thank you.